All right, so let's talk about what happens when you yank away safety nets like food stamps and Medicaid. Honestly, it's like pulling bricks out of the foundation of a house and expecting it to stand upright. The cracks always show up.
A deliberate dissection of societal stability. Yes, those cracks you mentioned, but they manifest in troubling ways, don't they? The 2021 study published in the Journal of Public Economics was striking in this regard, documenting substantial increases in theft and burglary after SNAP benefits were reduced.
Exactly. It's not surprising, though, is it? I mean, when parents can't feed their kids, they're not out there debating crime ethics. They're just trying to survive. In Sao Paulo, I covered this firsthand. I mean, you could see it right on the streets. Dads trading family heirlooms for scraps of food, kids pickpocketing just to get by, the look of desperation in their eyes. It sticks with you.
Your description is visceral. It aligns with what criminology teaches us about survival-driven behaviours. Property crimes become a lifeline for the desperate, and if I recall correctly, weakened social supports also correlate strongly with violent crime. It's not just theft; it spirals into something far more complex.
Yeah, yeah. And did you see the research linking Medicaid to crime reductions? Like expanding Medicaid under the ACA didn't just help hospitals, it cut violent crime, drug related offenses too. Sounds counterintuitive at first, but it's all connected. Healthcare, mental well being, and honestly, just stability.
Absolutely. It's the evidence speaks to the humanity often lost in policy discussions. Denying basic needs like healthcare creates untreated mental health crises, substance abuse spikes, and consequently erratic behaviors that often escalate into criminality. The downstream societal costs are monumental.
Right. It's like the system sets people up to fail and then punishes them for it.
Precisely, and it's not just the immediate rise in crime, Nikki. These policy decisions carry profound intergenerational consequences. Unstable childhoods, increased trauma exposure, developmental hurdles.
Yeah, it's like a chain reaction. And the irony? Cutting these programs to save money completely backfires. States spend more on law enforcement, emergency care, jails, the list goes on. You're not saving anything, you're just making the problem harder to fix.
Well said. It's fiscal short-sightedness, isn't it? Like neglecting routine car maintenance only to face a full engine replacement. The cost grows exponentially, but the immediate savings serve as a mirage.
And meanwhile, it's people, the most vulnerable, bearing all that weight. Honestly, John, sometimes it feels like the system's designed to fail them on purpose. And the fallout doesn't just disappear into thin air, right? Someone always has to step in to pick up the slack left by slash social programs. More often than not, it's the police, expected to handle situations they were never really equipped for.
Indeed, this is where the lines begin to blur. Police, originally tasked with maintaining public order, increasingly find themselves acting as de facto social workers, addiction counselors, even mental health crisis responders. However, they are neither trained nor resourced for these roles.
Exactly. And that's when things get messy. Like imagine sending someone with zero medical training into a mental health emergency. That's happening every day. And the results are predictable.
It's more than messy. It's a systemic misallocation of resources. From my intelligence work, I saw similar patterns in destabilized communities. When institutions like healthcare and education fail, law enforcement steps into the vacuum. But this reactionary approach merely treats symptoms rather than addressing the root causes.
And the cost? Astronomical. Like the money supposedly saved by slashing Medicaid or food stamps just ends up funneling into bloated law enforcement budgets, emergency room visits, prisons. It's a shell game, but no one's really winning.
Precisely. There's a study, Health Affairs, if memory serves, that quantifies this cost disparity. For every dollar cut from programs like Medicaid, states can spend multiples addressing the downstream effects, heightened emergency health care burdens, increased incarceration rates, and the perpetuation of public disorder.
It's like trying to mop up a flood with a single towel and then being shocked when the room's still full of water.
An apt analogy, what policymakers often overlook, is the far-reaching impact of their decisions on public trust. When communities are destabilized, people lose faith in the systems designed to protect and support them. Trust is, after all, the foundation of societal cohesion.
And when trust's gone, what do you think fills that vacuum? Fear, frustration, anger. It's like gasoline on a fire, and suddenly you've got protests turning into riots or even worse.
History demonstrates this vividly. The erosion of social safety nets not only undermines public health and stability, but shifts entire paradigms of governance. Reactive policing becomes the centerpiece, a band-aid on an ill-constructed framework.
And that band-aid has no chance of holding when the next blow comes. It's fragile, just like the lives it's supposed to protect. This strain we're talking about has another devastating consequence: kids. Cutting programs like Medicaid and food stamps doesn't just destabilize communities. It seals an even grimmer fate for the next generation by stacking the deck against them before they even get a fair chance.
It's a complex domino effect, isn't it? Nutritional instability alone can lead to developmental delays, both mentally and physically. Add to that the lack of health care, and the consequences escalate dramatically.
Exactly. And honestly, it's infuriating. Like, we know what happens when kids grow up hungry or without medical care. Higher dropout rates, yes, but also trauma that follows them for life.
Trauma that imprints itself, shaping behavior, decision-making, and even their ability to trust. Science has repeatedly shown the lasting impact of adverse childhood experiences, or ACEs, on future mental health and societal outcomes.
Yeah, and it doesn't just stay in one generation either. Kids who grow up in survival mode are more likely to pass that instability onto their own kids. It's a vicious cycle.
Precisely, Nikki, and this extends into education. Children without stable food or access to healthcare often struggle academically. When they fail to thrive in school, it increases the likelihood of disconnecting entirely, and disconnection invites susceptibility to risky behaviors.
It's all connected: nutrition, healthcare, education, opportunity. You starve one and the others collapse, and then we wonder why we see higher rates of crime or addiction. It's right there. The system failed them before they even had a fighting chance.
This creates broader ethical questions, doesn't it? If we acknowledge that society's role is to provide equitable opportunities, then neglecting children's basic needs directly contradicts that principle. The erosion of opportunity is its structural violence.
Structural violence. Yeah. I mean, isn't it just as violent to let a kid die from untreated asthma because their family couldn't access Medicaid as it is for someone to break a window looking for money? Both come from the same system that abandoned them.
So that's a brutally honest but accurate perspective, and yet policymakers frame these cuts as fiscal responsibility. What they fail to acknowledge, or perhaps deliberately ignore, is the human cost of those policies.
Human cost. That's exactly what it is. And the saddest part, these choices aren't made in ignorance. They know what the fallout will be, John. They know it, and they do it anyway. It's like the cruelty is baked in.
Therein lies the ethical dilemma. Governance should aim to create stability and foster equity, but choices to dismantle the social safety net seem at times indifferent to those very ideals.
And the kids, they're stuck with the fallout. They're the ones paying for somebody else's budget wins. It's maddening.
And heartbreaking, Nikki. If we want fewer societal challenges, less crime, better public health, stronger communities, we must begin with the foundation: children. Investing in their well-being is not merely moral, it's strategic.
Right. If you want fewer criminals, don't manufacture more desperation. It's not that hard to figure out.
Precisely, and that's the heart of it. The way we treat society's most vulnerable is a reflection, perhaps, of the society we choose to become. A contemplation worth holding on to, wouldn't you say?
Yeah, for sure. And on that note, I think we've said what needs to be said for now anyway.
Indeed, Nikki. Until next time.